Hi B. I'm gonna try to give you a little help with acids and bases. So I've drawn out an acid-base spectrum. So on the left-hand side, 1 to just under 7 is acids. Just over 7 to 14 is bases. And then 7 is neutral. So if color works for you, you could think about blue bases. You can also think bases tend to be slippery. Bleach is a good one. Ammonia is a good base or a good alkaline. Hand soap. My well water has a pH of about 8. Acids tend to be things that are kind of like Sour Patch Kids, like they make you pucker, or they feel squeaky clean, or they also tend to make you red as well. I accidentally got hydrochloric acid poured on me just a little bit by one of my high school students, and I had a pretty good red scar for quite a while. It wasn't big, but it was a red scar, so maybe that will help you remember. The other thing I'll show you is a memory trick to help you remember hydrogen ion concentrations, because that's what pH is. It's a function of how much free hydrogen ions are in a watery solution. So if I'm looking at acids, the amount of hydrogen ion increases the stronger the acid is. Conversely, the amount of hydrogen ion decreases, and that makes pH go up. So as hydrogen ion concentration decreases, pH will increase, meaning it gets more and more and more alkaline or base. As hydrogen ion concentrations increase, that means pH decreases. So if I had, say, a neutral solution and I added vinegar to it, I keep adding vinegar, which I think you know is an acid, and the pH will keep going down and down and down. So hopefully that helps a little bit. I think acid-base balance is pretty important in nursing to at least understand what is meant by something like metabolic or respiratory acidosis, and to be able to read a lab report. And if that lab report were to say something like, my patient's blood pH is now down to 7.2, what's that mean? And I'm pretty sure that you have to understand that that means the patient is in acidosis, and it would be respiratory or metabolic, depending on whether it's a problem from the respiratory system or pretty much all the other ones. And then what's acidosis do? The big problem with acidosis is it depresses the central nervous system. So if you think about, say, medulla, pons, hypothalamus, think about what those structures control. You're going to see all your vital signs start to depress. And your other question was about hormones that would be good to know for nursing school. So I can only tell you what I know from what students have told me. So the RAS system comes up because most hypertension meds their mechanisms come from the RAS system. So something like an ACE inhibitor, which means this process doesn't happen. You can't make angiotensin II. It doesn't block all conversion, but a medication like an ACE inhibitor would block some of the formation of angiotensin II, and then all those mechanisms that angiotensin II does to elevate blood pressure are blocked. But you don't want to block them all, because you don't want to block every conversion, because then the person, if they're in danger, couldn't elevate blood pressure appropriately. There are angiotensin receptor blockers. I think Denise Ruby told me there are renin blockers. I know there's ACE inhibitors. And there's alpha blockers to block alpha adrenergic receptors, beta blockers, calcium channel blockers. So these aren't hormones, what I'm talking about here. These are medications that would affect hormones. I think aldosterone is probably pretty important. ADH, because the medication form of ADH is vasopressin. So you might want to ask Sonia Kirkendall, or you could ask Denise Ruby, but I might want to ask Sonia, because she's a program director for nursing in Claremont, and maybe she can give you a better idea. Thyroid hormones would probably be a good one as well. But don't forget, there are free online A&P textbooks, and they're in your syllabus. You could, years from now, you can look up that textbook and look up a hormone, right? Let's say you have a rash of patients that come in with hypothyroidism. You can go to that textbook, you can look it up, and you can remind yourself of what you've learned now, but you have that base knowledge to build on from our class. So I hope you enjoyed this video, and if you need anything else, please let me know. I'm happy to help. Even if you want to meet on Zoom or something at an hour that isn't my normal hours. I'm usually in bed by about 10 o'clock, but I can still think up to then, and I'd be happy to meet with you if you want to.